Chapter 26, the patient's dental record. The dental record is a complete history of an individual's dental care. Whether you are communicating with the patient by phone or in person, the patient record must be available for reference. A patient's record is organized in a specific order to allow the dental team to move from the patient's personal information to the diagnostic findings, and then finally, the documentation of treatment. The dental record is a permanent record, personal and legal documentation of the patient. Privacy, HIPAA requires that all dental practices today have a written privacy policy. Quality assurance, primary source of information used by the dental team to determine the overall quality of care the patient has received. Risk management, proper documentation helps avoid litigation and research. Dental record systems. Paper dental records are inexpensive initially and easy to customize. Electronic dental record, more than 75% of practices now use some form of electronic record. Benefits to going paperless include access to dental record is safeguarded, to perform practice management, to allow the dental team to enter relevant clinical documentation, prescriptions, etc., to share health information with authorized providers. Components of the dental record. Information gathering forms, which include patient registration form, medical dental health history form, medical alert information, and consent forms. Patient registration. Patient information would include full name, date of birth, residence, phone number, employment, spouse's information. Insurance information includes the employee's name and date of birth, employer's name, address, and phone number, name of insurance carrier, and policy number. The responsible party is the person responsible for payment of the account. Signature and date used to verify the accuracy of information. Medical dental health history. Medical history are questions regarding the patient's medical history, present physical condition, chronic conditions, allergies, and medications currently being taken. Dental history is information about the patient's previous dental treatment and care, and how the patient feels about dentistry and how important dental care is to him or her. Medical alert. Review indications of health conditions, allergic reactions, and medications that could interfere with or be life-threatening to the patient during dental treatment. Medical alerts and other precautions should be entered into the dental record. If using paper forms, an alert sticker should be placed inside the record. Medical dental health history update. The patient must update his or her medical dental health history at every appointment. Health information that may have changed could include diagnosis of medical conditions or medications. Diagnostic information gathering forms include physical examination form, radiographic examination form, and clinical examination form. Clinical examination form provides the dental team with past, present, and future examination, analysis, and charting needs of the patient. It would include the patient's name and date of examination, charting of existing restorations and present conditions, charting of periodontal conditions, the patient's chief complaint, findings of occlusal evaluations, findings of temporomandibular joint evaluations, and any additional comments. Treatment plan. Record the plan of care on treatment plan form, properly sequenced to address all problems that were identified during examination and diagnose portions of the patient's visit. The treatment plan may change course if financial arrangements become a factor. Informed consent form. This form is related to a specific treatment or procedure. It provides the patient with the expected outcomes of treatment and describes any possible complications that might occur. This is commonly used for invasive or extensive treatment, such as in specialty procedures. Progress notes. Treatment is recorded in this section of the patient record. Should always include the date, tooth number, completed treatment, and any communication with the patient. Entering data in the patient record. Every entry in the chart should be made as if the chart will be seen in a court of law. At the conclusion of a procedure, the details of what was accomplished will be entered in the progress notes section. If corrections are necessary, incorrect information must be preserved and not deleted. Follow specific guidelines for paper and electronic records.